I'm Rob Griffin, Department of Radiation Oncology, and I'm a radiation biologist at UAMS, working in tumor cancer biology mostly. And the reason I want to be a part of the nanomagnet group at UAMS is that a lot of our research revolves around experimental therapeutics, and one of the best ways to deliver some therapeutics is through nanomedicine approaches. And some of the areas that I've gotten into in the last couple years are to look at what's called a gold-tagged nanoparticle. And there's one in particular that's in clinical trials already. It's in phase 2, and it's a gold nanoparticle. It's about 30 nanometers wide, and it's labeled with a protein called tumor necrosis factor. And in the past, tumor necrosis factor has been very effective at solid tumor therapy in preclinical models, but when it's gotten to the human condition, it's been too toxic for the patient. So what a company out in Maryland has done is tagged these gold nanoparticles with this TNF protein, tumor necrosis factor. And what they've found is that when you do that, you reduce the systemic toxicity quite a bit. So our work has been to use that particle not only by itself, but also in combination with radiation therapy and also thermal therapy. We do a lot of, since I'm a radiation biologist, we do a lot of studies that look at the effect of radiation in combination with other therapeutics. And we've been able to show that by combining either radiation or thermal therapy, which is using either heat or cold to treat the tumor, if we combine that with an injection of these gold nanoparticles, we're able to greatly enhance the effect of the therapy. And so that's really an aspect of our lab that's looking at a nanoparticle that's already in clinical trials and trying to do something more, an improved method of using those particles to further enhance what we can do with nanomedicine. Another major area of our group is looking at how we can deliver other drugs to the tumor using a nanoparticle or nano-based approach. And what we're doing there is we're using liposomes, which are actually like small vesicles made out of lipids that have a hollow interior, and you can fill that interior with drug. And what we've been able to find is we've discovered a couple of proteins that will target the solid tumor environment, and we put those proteins on the outside of this liposome, and then we add a drug that we know is going to be effective for the cancer. We add that drug inside the liposome. And therefore, in that way, we can direct the medicine to the cancer and avoid a lot of the normal tissue consequences that usually happen with a lot of cancer drugs. So those are two major areas that we're working on, and we've been able to prove that a nano-based approach can be very effective and improve upon what we already know some of these agents can do.